Hi, thanks for tuning in to this GAP MASLD MASH Community Network information session. My name is Lindsay Yoder. I am a PA in hepatology at Indiana University in Indianapolis, Indiana. I have been in hepatology since 2017, so going on 8 years now. And I wanted to take some time to share some information about pharmacotherapy options for MASLD and MASH. And so there are some common questions that we get as far as like primary targets, right? The histologic endpoints for pharmacotherapy that are currently approved or in development for MASH. This has been a struggle for MASH clinical trials as far as picking the right clinical endpoint that will meet statistical significance in a timely enough manner to, design trials that you don't have to do for a decade to see fibrosis improvement. But with Resmetirom, which is the first FDA-approved drug to treat MASH with stage 2 to stage 3 fibrosis, those histologic endpoints were twofold, basically. So making sure that there was hepatic fibrosis improvement was one endpoint, and then improving or resolution of steatohepatitis without any worsening of fibrosis. And same thing with the fibrosis. So improvement in fibrosis, but without any worsening of the steatohepatitis. So for Resmetirom in particular, in terms of fibrosis improvement, at the two different doses of Resmetirom, 80 milligrams, 100 milligrams, there was a 23% and 26% improvement compared to 14% with the placebo. So this is around 1.5 to almost 2 times as many patients who were on Resmetirom that had an improvement compared to the placebo in their hepatic fibrosis. And then in terms of the MASH resolution with no worsening of their fibrosis, those patients who were treated with Resmetirom 80 milligrams had 26% resolution versus 30% of patients on Resmetirom 100 milligrams who achieved MASH resolution without any worsening of their fibrosis. This is compared to 11% in the placebo group. So this is around 2.5 to 3 times more patients that achieved MASH resolution with using Resmetirom. And so these two primary endpoints are what led to the conditional FDA approval. Studies are ongoing to show, further long-term data, but it was the first therapeutic to get there. Some other things are close behind with some possible approvals later this year or next year. And so a lot of people want to understand, how does this drug work? How safe is it? Is it something that I should be using for my patients? And so in terms of Resmetirom and the way that it works, this is a thyroid beta agonist. And so it stimulates the thyroid beta receptors. This helps in the liver to stimulate the thyroid beta receptors to regulate better expression of genes that improve the lipid metabolism. So you're basically creating hypermetabolism in the liver. This is going to reduce the fatty acids, reduce the inflammation, and overall, this is helping address the drivers of MASH and fibrosis to reduce liver damage overall. In terms of tolerance, Resmetirom seems to be pretty well tolerated. There are some side effects that patients have experienced. Somewhere between 20 and 30% in our real world data has some side effects like GI distress, belly pain, constipation, diarrhea, and some of those can be mitigated by quick follow-up, nursing phone call, hepatology or GI provider phone call within the first couple of weeks of starting the medication, because what we tend to see is that those side effects will come on somewhere 2 to 3 weeks after starting it. And then most patients, they're going away by week 3, week 4, week 6, if they can stick with it. So overall, pretty well tolerated. And really, I think early intervention by the provider to identify those patients who do have side effects and then trying to help them mitigate and work through them are what's helpful. So in terms of drug-induced liver injury, no high concern for that. There can be some interaction with certain statins, so sometimes you need to dose reduce the Resmetirom. overall, the patient profile and the candidates that we're using this for is exactly who it's approved for. Patients who have MASH or presumed MASH with F2 to F3 stage of hepatic fibrosis. We're not using this in patients who have cirrhosis. It is not approved yet for that. And in patients who have no or early fibrosis, they're not a candidate yet for this either. We're really using elastography, histology to hone in on F2 to F3 fibrosis. And this is meant to be used along with diet and lifestyle modifications. So the things that we have always done to treat our patients with MASLD MASH in terms of diet, lifestyle modifications to reduce or eliminate their cardiometabolic risk factors, those things are still as equally important and need to be continued and need to be emphasized along with those that are F2 to F3 fibrosis and have an opportunity to take advantage of Resmetirom. And so when we initiate this for our patients who meet the criteria, we have a discussion with them about the phase 3 clinical trial data, the efficacy, those endpoints, who it's intended for, the side effects, the risks, and what we're going to plan to do from there on out. So after prescribing, again, I make sure we have close and early check-in with our liver nurses who call patients about 2 weeks after starting the medication. This is to check in on any new symptoms that could be side effects of the medicine. And after 3 months, we're going to check a hepatic panel. This is to make sure if someone had normal liver enzymes, that those haven't risen for some reason. And then those that had elevated liver enzymes to begin with, I'm interested to see what those have done after 3 months. Are they stable? Are they lower? Hopefully they're not higher. And then I'm checking in with patients in person in my clinic in about 6 months after starting Resmetirom. Again, equally asking them about their success or barriers with diet and lifestyle modifications along with the medicine. And then I am waiting 12 months before I repeat a FibroScan specifically to look at that liver stiffness measurement and see after 12 months of treatment with pharmacotherapy and diet and lifestyle modifications, how have things changed? And then depending on if that is stable, improved, worsened, that's informing next steps and plans of care. Again, the continuation of diet and lifestyle modifications, regardless, is going to continue. So thank you for tuning in. I hope this gives a little bit of insight into our MASLD MASH community network about the pharmacotherapy that's available for MASH with F2 to F3.